My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider.
Hi, this is Dr. Frank with My Doctor Said What? Available on podcast everywhere from iHeart to Spotify to Amazon and Apple, and on YouTube as a video. You don't need to look at me, you just need to listen to me. Even though my wife thinks I'm handsome, doesn't mean you have to think. So I sound much better than I look. And you say, those that do view, why is he wearing the same clothes? This guy never changed? No, I do several of these at one time. They come out every Tuesday around noon, but they're available online, on demand, and I have to produce several at the same time. My producer pretty adamant that they don't want to spend weeks doing these things, and we don't edit. And you probably know that by listening to them. You probably say, my gosh, it's a conversation. I want to have a conversation with you as a public health doctor and as a pathologist and toxicologist, let you know the causes and prevention of disease. But you need to talk to your local healthcare provider and have a great relationship with them to live a better, healthier, longer life. So today we're going to talk about two things. We're going to talk about the terrible C word, cancer. And we're going to talk about what does color in your urine mean, a follow-up to our blue poop conversation. So what does color in your urine mean? First of all, healthy urine should be pale yellow and not cloudy. Cloudy means you have excess mineral, sugar, or bacteria, fungus, or viruses in there. And anything other than pale yellow means you can be dehydrated or you've got a kidney issue. So if anything changes, especially suddenly, and lasts for more than a day, you really need to be careful, especially if you hydrate and it doesn't change. Dark yellow urine usually means you're dehydrated. And there are some medications that can cause that, but your doctor should tell you, or your healthcare provider should tell you, your PA or your nurse practitioner, or you should ask and read the label on the medication, or ask your pharmacist. Now, there are some vitamins and supplements that can cause discoloration of your urine too, and you need to ask about those. Don't go to Dr. Google, but go to WebMD or some reliable source, your local university that has a medical school. Look at their websites and then Mayo Clinic's website and find out what the scoop is, and then talk to your healthcare provider. Orange urine, you got to be careful. When it starts turning orangish, which sometimes is hard to tell, it means you can be dehydrated and it's just dark yellow, but it can mean that you potentially have liver disease. So you want to take care of that. If that doesn't change with being well hydrated, and remember, you're supposed to drink 8 glasses of water a day. Nobody drinks 8 glasses of water a day. Now, I know somebody's going to write in and say, yes, I do. I drink 12 or whatever. Let me tell you, I mean, in general, most people don't. It's hard to drink 8 glasses of water a day, but it's not hard to drink that much liquid. And most liquids, if they're not caffeinated and they're not alcoholic, are still great for you. As long as they don't have too much sugar or sodium, drink them. I drink a lot of unsweet tea because I'm not a big water fan. I do drink a fair amount of water, but I like a little bit of tea in there, and green tea is a wonderful thing from a medical perspective, so that's what I drink a lot. I used to drink soda, and then it's just way too much sugar. I'm hypoglycemic, which is the kind of the opposite of being a diabetic. I have to eat on a regular basis and not get too much sugar because I have a condition I was born with, a congenital condition that I have too much sugar leaves my urine, and the insulin gets too high, and then my blood sugar drops too low, which amazingly, even I learned a few things in my later years, and your blood pressure can be adversely affected by your blood sugar. So if you're having an up and down blood pressure that's not consistently high or low, you need to look at medications, and you need to look at things like your blood sugar level. So red or pink urine usually means blood in your urine, and that can be from a UTI. Most normally it can be from kidney stones, and it can be, at worst case, bladder cancer. I definitely go with the easy stuff first. It's probably blood from a UTI, but you just don't fool around with that. You go to your health care provider. The early detection is really important in any disease because effective treatment is much, much better and prevention's even better. So then we get to brown urine, and that's bad because that's beyond dehydration and dark yellow and orange. That's when you have breakdown of things like muscle tissue, such when you have liver disease. There can be a few medications that cause our medical conditions, but a lot of times that means breakdown of muscle tissue. People that lose too much weight too quick can have brown urine. There you're losing organ and muscle mass, and that is not something you want because you're going backwards. Even though you're losing weight, you're losing your driver of metabolism, which is your organs and muscles. You're trying to get rid of fat tissue, not of healthy tissue. So you got to do that in a controlled and good way. And if you're really good and you can stick to the right kind of diet and get the right nutrients, then you're going to have a lot of success, and you can lose up to half a pound a day. After that, it starts getting a little shaky. You need to really talk to your healthcare provider if you could lose more than that in a healthy way. And if they say you can't, go for it. I'm all for it. But you're going to have to change your lifestyle because you want to keep that weight off. You don't want to bounce something down like we've said in previous podcasts. Fun fact here, people give dairy a bad rap. They want to get oat milk or soy milk or almond milk. And you know, if you drink low-fat milk, you don't want full-fat milk. That's the problem. Is the fat milk itself has a wonderful set of enzymes and amino acids that are perfect. That's why all young mammals have milk as the thing that sustains them. It's one of the best, most complete foods on the face of the earth. So don't buy into that, oh, milk's bad for you. Milk is not bad for you. Now, if you're lactose intolerant and you don't want to drink lactose-free milk or take a pill that helps you digest lactose, then you may have to look at an alternative. But nothing will replace good old-fashioned low-fat milk in being a very complete source of protein, carbohydrates, and good fats. So, fun fact there. And nobody, again, no dairy farmers are paying me. That's just, if you look at the overwhelming amount of evidence, it's pretty clear. Last but not least, blue or green urine is rare. And that's caused by certain medications or genetic disorders such as hypercalcemia. Those are really rare. If you have blue or green urine, it's not going to go away in a day, and it's not going to happen overnight. And that's something, obviously, you'll be tested for. And if you don't notice that you have blue or green urine, you need to get your eyesight checked. And you need to be a little more aware. Remember, you're the person that should be looking for abnormal moles or any other thing, different skin conditions. You're the person, hair loss, any of those things, loss of vision, dizziness, anything in your daily life that's out of the ordinary. If it happens on any kind of recurring basis, you need to find out why. It's amazing how many strokes could be prevented if people had yearly physicals and followed their healthcare provider's advice for prevention. And that's the number one cause. Heart disease and strokes are the number one cause of death in America. The number two cause is our next topic, which is cancer. What is cancer? Cancer is not just a single disease. It's multiple diseases caused by multiple factors, from viruses to chemical insults to all kinds of things, to radiation such as skin cancer. So what you've got are an overdose of x-rays. So now you have what? You have uncontrolled growth of abnormal cells in the body. Normal cells become abnormal and they continue to grow. That's what a tumor is. And they displace the good cells that are trying to function in an organized manner. Your body is an incredibly complex and beautiful machine that needs to be in homeostasis. That means balance, equilibrium. And all the functions are going well. When you're sleeping enough, you're eating right, you're exercising, your body will perform at optimum capacity, mentally, emotionally, physically. And if it's not, all those factors are going to have issues. So just think about that. Believe it or not, poor nutrition can cause emotional health issues, cause you to get angry quickly, cause you to be overstimulated, understimulated. There's a lot of research in that field, so you have to be careful. Just eat a healthy, well-balanced. I've talked about the DASH diet, the Mediterranean diet, which are two of my favorites, and I think they're definitely the way to go. It's not that hard to figure out. And then you've got to figure out what your calorie balance is. I'm fairly active, but I'm also old as dirt. So at 65 years old, my metabolism has changed over time, and I could used to eat 3,000 calories a day. In college, 4,000 calories a day and didn't gain a pound. Now I swallow my own spit and gain weight. So I'm down to about 22 or 300 calories a day, and I've got to make sure those are healthy calories every day. And like I say, I'm active, but that's unfortunately just the way it is. And I'm a 190-pound person at 188 at 6 feet, a little over 6 feet tall, and I know what I can eat when I can't. That's why I have a scale. Don't overweigh yourself. That'll make you a wreck. Your weight can change 4 or 5 pounds in a day with hydration and all kind of things. So what you need to do about once a week, same time and the day, when you get up, you need to be careful and to monitor those things and maintain that healthy weight. No fad diets. Cancer, some of the things we eat can be an issue. But because it's the second leading cause of death, what are your risk factors? Age, genetics, and lifestyle, such as tobacco or alcohol consumption, poor diet, lack of physical activity, exposure to certain chemicals or environmental toxins. Radon, we talked about that before, horrible. You get your house tested for radon if you live in a radon area. It's like smoking 3 packs of cigarettes a day. It's a terrible thing, and it's so preventable, and you don't even know it's killing you. So look at those kind of things. Evaluate. You're the one that's responsible for your health. The risk of cancer increases significantly with age. Over 60, or 65, about 60% of the people that are diagnosed are over 65. Just a fact. Our bodies break down no matter how well you take care of them, but if you really take care of them and you got the right genetics, you'd certainly rather live a happy, healthy life to 90 plus years old than to die at late 60s or early 50s of lung cancer or diseases that are very preventable. Early detection, that's why you go have a physical every year. If you're a woman, you need to get a mammogram, and some men need to get mammograms. You definitely, I hate to say it, but you got to get a colonoscopy every 5 years, starting no later than 50, and they prefer at 45 if you're a person like me. I have predisposed to colon cancer. My immediate family, my father had colon cancer, and so I have to be careful. I think I have a better diet, but thinking doesn't keep you healthy. Being tested, getting that colonoscopy, it's not that bad. It's made a lot of improvements in colonoscopies these years, and no, there's not a virtual one that works as well as the real deal of putting that camera up your back end with a competent proctologist. And I'd ask you to make and schedule those appointments, and your primary care physician will make sure you do that. But listen to them, he or she. So, also pap test for women. You need to get those things on a regular basis. Blood tests, I've talked about physicals before, what you need to have, your blood panels and this and that. You need to do that. If you didn't hear my podcast earlier, listen to the one about lab tests and what you need to get every year. Those early detections will make the difference between great survival and relatively easy treatment versus a really life-changing, difficult situation. We've had some great advances in cancer treatments, and so you need to really embrace that early detection is your number one friend. People know, you do want to know, believe me. So now, the most common cancers that we have are breast, lung, prostate, and colorectal. So you definitely need to be looking out for those things. And let me tell you this, a lot of people they want to say, oh my gosh, I'm predisposed to breast cancer, male or female, men can have breast cancer, so they want to do really like surgeries and that to prevent it. Remember that heredity loads the gun, but environment pulls the trigger. So if your lifestyle is good and your environment's good, you can avoid those, even though we're all predisposed to a lot of things. But that doesn't mean they're going to develop. Remember, cancer can have significant emotional and financial impacts, just like diabetes. It's amazing. Type 2 diabetes, if you avoid it and you become much healthier and you don't have to take medication, you can save hundreds of thousands of dollars during your lifetime. So the average retiree spends $300,000 in retirement on unpaid medical bills. So prevention is by far, it's not only smart, it's financially a great thing. Last of all, I'll say that healthy diet, regular physical activity, and avoiding tobacco and excess alcohol, vaping, any kind of smoking of any compound, and detecting for radon are easy things to do that will make a huge difference in your cancer risk. And stay out of the sun, or wear your sunproof clothing like these rash guards. Wear a hat with a bill, hopefully one that's just a big rim hat, keeps your using that good, and reapply your sunscreen over SPF 15 on a regular basis. Have a great day. This is Dr. Frank. Appreciate you listening.
Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.